Hi, I'm Sara Kohlbeck. I am the director of the Division of Suicide Research and Healing in the Comprehensive Injury Center at the Medical College of Wisconsin, and I'm also an assistant professor in MCW's Department of Psychiatry and Behavioral Medicine. The research project that I'm working on is related to the impact of police violence and experiences of police violence on the mental health of young Black men living here in the city of Milwaukee. This research is important because we know over the past decade or so, even while suicide rates are decreasing among white non-Hispanic individuals and folks in our communities, we are seeing increases in suicide among minoritized groups, and especially young Black men. And we also know that the social context is changing, particularly since the COVID-19 pandemic and sort of the social unrest that accompanied much of that time period in our society. We're really interested in seeing how these exposures to police violence, both directly and vicariously, again, impact and influence the mental health of young men, and particularly young Black men, even to the extent that these interactions are associated with suicidal thoughts and behaviors. This work is supported through a grant from the CDC, the Centers for Disease Control and Prevention. This funding actually is part of a larger center grant that was awarded to MCW's Comprehensive Injury Center. Within that center grant, there are 4 research projects that are funded, and myself and Dr. Quinn, my co-investigator, were fortunate enough to have this project funded through that CDC center grant funding. So without that funding, this work would not be happening, and so we're really grateful for that funding from CDC. Yeah, this project I think really matters for a couple of different reasons. I mean, we have sort of the, I think, obvious potential impact of improving mental health among a group that is experiencing poorer mental health in recent years. So certainly that's important. Because this is a public health focused project, we're also really interested in focusing on the impacts as it relates to policy and systems change. So we hope to be able to use the findings from this project to be able to talk with stakeholders and partners in the community, potentially including law enforcement and justice systems, to really think through how policy and systems change can take place in order to result in more positive outcomes sort of in the mental health and suicide prevention space for everyone. Suicide is a problem for communities. It's not just an individual issue. And so the more that we're able to tackle this issue at the individual level, the healthier our communities are going to be.